I'm very happy that the program manager for viral hepatitis is here because he'll answer all your questions. So today I'm going to be talking about expanding access to hepatitis C treatment through our Stop Hepatitis C program. So this is the outline of my presentation, and some of the components of this work have been funded by Gilead Sciences and Roche Diagnostics. So when we take a look at the burden of hepatitis C in Ghana, in terms of seroprevalence, several studies have put the prevalence between 2.5 to 3%. And in terms of the proportion who are viremic, one small study in northern Ghana showed that about 60% of people who test antibody positive are viremic. Modeling data from the CDA Foundation estimates that about 460,000 people in Ghana are living with hepatitis C infection. And we see that the burden is higher in the northern part of the country, and it's also higher in the older population. Where are we as a country in terms of progress towards elimination? We see here that we're not doing as well as we could be. In terms of the number of people who have been diagnosed, that's about 13%, and of those, only about 1% are on treatment. When it comes to blood safety and injection safety, Ghana is doing well with that, but there are currently no syringe exchange programs. For risk factor evidence, again, a small study done in the north of the country showed that older age, persons with a history of female genital mutilation or circumcision, unsafe circumcision, maternal history of testing positive for hepatitis C, and positive HIV status were associated with testing positive on screening for HCV. So one of our senior colleagues, Dr. Adjoaje, who is the co-chair for the LOC, always likes to remind us that Stop Hep C was born out of Egypt and Ghana's love story. Egypt are our in-laws, she likes to say, because the very first lady of the country was actually from Egypt. So Osajifo Dr. Kwame Nkrumah's wife was Egyptian. So the Ministry of Health made an application to the government of Egypt to support screening and treatments for hepatitis C through their presidential initiative, which pledged to treat Africans living with hepatitis C infection. So in March 2023, this commitment was secured, and Egypt donated the first batch of medicines to Ghana. This marked the beginning of the program, which was led by the National Viral Hepatitis Control Program, with the objectives of identifying and linking hepatitis C positive patients to care, strengthening health information and capacity of healthcare workers to treat patients with hepatitis C, and then also to review national policies for viral hepatitis elimination. So lots of implementing partners were involved, including the Ministry of Health and the Ghana Health Service. We received technical assistance from the WHO country office, the Coalition for Global Hepatitis Elimination, and very strong civil society support through our Gastroenterology Association, GASLID, as well as the Hepatitis Alliance of Ghana. So in terms of implementation, we began planning and technical assistance through bi-weekly hepatitis C treatment strategy meetings. We wrote funding applications to support capacity building and healthcare worker training. We undertook a KAP survey and then a public awareness campaign after that. And then throughout, we implemented this free treatment campaign. In terms of our treatment strategy meetings, these were led by, I'm sure you know many of the faces on this slide, Prof. Manal El Said from Egypt, Prof. John Ward, Dr. Chu, who is our program manager, WHO country guidance from Dr. Kafui Senya, and really the glue putting it all together was Dr. Lewis Roberts. And throughout the conversations, we ensured contacting civil society, including Hepatitis Foundation of Ghana. Prof. Charles Ejay is here today, he will speak, as well as GASLID, which is the Gastroenterology Association, and received a lot of guidance from Dr. Mwakudua. So we received the first batch of medicines, as I said, in 2023. That was enough to treat 1,000 people. And this was the first time that a decentralized approach to hepatitis C management was attempted in the country. We relied on opportunistic screening, so civil society-led screening, self-referral, blood banks. But really, currently, there's no population-based screening approach in the country, and that limited the number of people that we're able to identify and link to care. Prior to the implementation of Stop Hep C, it was really a gastroenterologist-led treatment service. Patients would have to go to one of 5 teaching hospitals to be able to access care, and cost of treatment was around $900. That's at a minimum, but it would be probably higher than that for many patients. When we implemented Stop Hep C, we had 19 case management sites, so expanded to regional hospitals, included 1 district hospital, and these were really non-specialist-led clinics with doctors, nurses, pharmacists, lab people, and then data managers. I must say that the treatment was free, but the testing was not, and one of the big challenges was being able to get people to do viral load testing because of the high cost. In this first phase, after we received 1,000 courses or treatment for 1,000 people, we reported, or the case management sites reported, putting 958 patients on treatment, and the majority of these were from the northern part of the country. About 86% completed 12 weeks of treatment, and about 1 in 10 would do a post-treatment HCV RNA. Of those who did, the cure rate was 93%. So yeah, most of the treatment numbers came from northern Ghana. We realized along the way that awareness was not as good as it should be, so we undertook an awareness survey just to try and find out where the gaps were. This survey showed that about half of the population had never heard about hepatitis C before, and only about 16% had ever tested for hepatitis C. We realized as well that there was a lot of misconception about modes of transmission, and it was also evident in this survey. We saw that many of the lay population, that's the general population, were not really aware or didn't know about how hepatitis C was transmitted, whether through like sweat, saliva, breast milk. Their response was, I don't know. And it was also interesting for us to see that amongst healthcare workers, some would respond that yes, hepatitis C was transmitted through sweat, saliva, and breast milk. So we realized that there was a need to really undertake an awareness campaign to dispel some of these misconceptions. So we did do that with the support of Gilead Sciences. We undertook a national awareness campaign. We really did focus a lot more in northern Ghana, but we went to churches, mosques, markets. We had an animation on national TV, on radio. We engaged with nursing students. We reached individual direct contact about 12,500 people, and through the TV and radio, an estimated population of about 2 million. We also undertook healthcare worker training, and we trained 671 nurses, doctors, physician assistants, lab personnel on hepatitis C, providing them with the right information so that they'd be able to offer the right information to their patients. Since Stop Hep C, if we look at what the testing numbers were for hepatitis C, in 2022, about 30,000 people were reportedly tested or screened for hepatitis C based on data from the national program. Fast forward to last year, 2024, screening numbers have gone up, reporting of about 133,000 people tested. Unfortunately, our data capturing is not as good as it could be. So because of that, for example, we don't have access to how many of these were positive. We don't have access to how many were linked to care, how many were put on treatment. And this just echoes, I think, what has already been said about improving data collection systems in our countries. So what are the next steps? We're awaiting our next consignment of Hep C medications. We are told it's in the pipeline. We just don't know how long the pipe is. So for patients who are able to afford, currently they are paying about $490. That's the minimum for a 12-week treatment course. The national program has recently applied to have sofosbuvir daclataxel listed on the essential medicines list so that it may open up the possibility of national procurement. We're currently undertaking a post-awareness campaign, KAP survey, to see the impact of our awareness campaign. We continue to engage the Ministry of Health and Government for the support that we hope they will give. And we are currently undertaking a validation study of the dual antibody-antigen assay to see whether that might be an option for Hep C diagnostics instead of relying on the RNA. And we continue to seek funding applications to further support this work that we are doing. So I'd like to acknowledge all of these societies and associations and organizations who have been instrumental in implementing this first phase of Stop Hep C. Thank you very much for your attention.